everyone, welcome to our wonderful vlog. I'm here today at Vista Gardens with Deb Bostwick, my favorite videographer. And thank you, Deb, for everything that you do. And we're talking today about an interesting subject, urinary tract infections and older adults with memory loss. So the reason we're bringing it up is most often they do occur in older adults who have memory loss due to the sheer fact of reporting, and symptoms can be different in older adults. I always encourage everyone to go to a urologist, but with, for example, caring for your older mom, she may not want to go to the urologist. She may not like to go out. She may have a doctor that comes to her. So it's not always applicable. However, it is a good thing to do, especially if there's repeated infections. But how do you detect these infections in older adults with memory loss is the question of the day, the question I get often asked and have a couple emails even today. So knowing the signs of a UTI in older adults with memory loss is so different from a normal aging older adult who doesn't have memory loss. And a lot of it's, of course, the frequency is that in women especially, shorter urethras you hear, hygiene, how often are they showering, and all of that gets a little complicated with memory loss. There may be a hygiene issue, there may be less hydration, maybe they're not drinking as many fluids. They may have an estrogen issue and that, they've gone through menopause or a weakened immune system. So all this contributes, yet how do we deal with it? How do we detect these infections that really can cause sepsis and so many issues, can go unrecognized or untreated for such a long time? So you have this person suffering when they shouldn't be suffering. How do we intervene at the right time? And it's really about knowing your loved one and knowing them so well that you can detect this sudden onset of confusion or agitation, or a lot of times they're up all night long with this little bit of suffering that starts and you don't really, well, they're up at night. Is this the disease? Is this because my mom has Alzheimer's disease or Lewy body dementia? Or is this an infection? Most often, if it started right away, you need to tell your doctor, started right away, the symptom that you're noticing, the increased confusion, the increased infection, the smell, maybe there's an odor, the wanting to go to the bathroom more often. But again, it can go untreated just because someone will think, well, they're incontinent now. Well, to get all of a suddenly incontinent is not normal. So taking your loved one, there are tips like taking your loved one to the bathroom, kind of smelling the urine, that will help a lot. Using a urinary dipstick will help, and there's various kinds you can buy at the pharmacy, and just dipping your loved one's urine, maybe even preventatively. You may want to dip every month like we do here. That seems to really help. You may get a false positive or negative, but you can always send out the urine to the lab and have your doctor order a urine analysis. That's even better. However, if you're really worried, dipping doesn't hurt. One other thing that a lot of older adults may complain of when, especially the families, when they do have a urinary tract infection, is also a sudden onset of falls. They may start falling just because they're weak. They're leaning to one side, drooping even, and you think, oh, stroke, but also check the urine. So checking the urine is just critical. When your loved one, or if they ever go to the ER, please ask for a urine analysis. You never know what could be in their urine. Also, you'd like to look at hydration issues in the urine. Probably, I would think they'd look at diabetes, sugars, leukocytes, nitrates, bacteria. All of that's critical to look at in an older adult with memory loss, so we can just make sure they're healthy. How do you prevent these really is the million-dollar question, and a lot of urologists recommend increased fluids. They do recommend sometimes an ultrasound of the bladder to kind of look at urinary retention. Is that a problem? Are they retaining fluid? But But as good practices, I'd say showering often helps. I know older adults in general don't like to shower, especially with memory loss, but just adding that showering is super important daily. I would think a bidet toilet. We do have bidets at all my facilities, and I even have them in my homes. I really think that warm water or cold water, whichever they feel comfortable with, there's different degrees, and the warm seat and the washing from the correct direction is critical. And the drying. Most bidets have a dryer with them. That bidet, I think, is really one of the few things that most older adults don't have in America and have in other countries, but it does keep them quite clean. So that is one area to help with prevention. Ensuring good hygiene is hard, but just making sure you have a good rapport, a good caregiver that can intervene and get them to shower, bathe, whatever they feel most comfortable with, and daily. That's critical. The water intake is a trick. Some older adults don't like to drink a lot of water. Maybe adding a little flavor to it might help, or any drink they love with water in it. That's all critical. I would think too, just having your physician check your older adults' urine randomly or preventatively, or even maybe make it in your head, write a little chart out every 3 months, whatever you feel is most comfortable for your loved one. Most importantly, I just want to not over reiterate, but mention over and over again that if there's a behavior change, that is super important. Or if anything changed, a sudden fall, confusion, immediate incontinence. They weren't incontinent before, but now all of a sudden they're dripping urine all the time. Just make sure those are big issues you would contact your physician for, or if they're living in assisted living, ask the facility there what to do. So thank you for tuning in on my urinary tract infection monitoring program. And if you have any questions at all, please let me know. Thank you.